Welcome to the regular meeting of the Public Health and Safety Committee for June 11th, 2025. I am Jason Chavez, and I'm the chair of this committee. Before we begin the meeting, I want to offer a friendly reminder to all members, staff, and the public that these meetings are broadcast live to enable greater public participation. These broadcasts include real-time captioning as a further method to increase the accessibility of our proceedings to the community. Therefore, all speakers need to be mindful of the rate of their speech so that our captioners can fully capture and transcribe all comments for the broadcast. We ask all speakers to moderate the speed and clarity of their comments. At this time, I will ask the clerk to call the roll so we can verify a quorum.
Councilmember Payne.
Present.
Rainville.
Present.
Ellison is absent. Palmisano.
Present.
Vice Chair Wansley.
Present.
Chair Chavez.
Present.
There are 5 members present.
Members, we have a quorum. With that, the agenda for today's meeting is before us. We'll first start off with the Victims of Police Brutality Honorary Resolution, which I will pass to Vice Chair Wansley to make a motion.
Thank you, Chair Chavez. This resolution was something that my office initiated about a year and a half ago, where we wanted to make sure that we're taking the time to not only uplift the victims or George Floyd as a victim of police violence in our city, but knowing that there are many other names that go unrecognized and that have not received traditional justice, and to be able to acknowledge that their experiences are absolutely something that we should not tolerate as a city enterprise, and that we continue to remain committed to making sure that we enact all measures around police accountability and reform, and also continuing to broaden the scope of our public safety ecosystem so that residents receive the right response at the right time, and that they have a public safety system that upholds and respects their rights on all fronts. So again, we brought forward this resolution this year. We're going to work with families who have been victimized themselves to do a presentation ideally next week. They were unable to make it today. So with that, I will make the motion to approve the resolution, and we'll ask for a second.
Second.
All right, colleagues, does anybody have any questions or comments? Seeing none, on the approval of this item, all those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? And that is carried to the full council. All right, colleagues, the next items are 2 of them. Item number 2 is accepting a grant from the Minnesota Department of Public Safety for the Minnesota State Auto Theft Prevention Grant. And item number 3 is authorizing a contract with the Minnesota State Patrol for a GPA agreement to assist with public safety and security measures. I will like to move item number 3 for a separate vote and discussion. Yeah, are you trying to move 2 as well?
I was going to, yep.
You know what? We're going to move both of these items separately so we can have discussion on them. So, on item number 2, are you on cue?
No, I was first, item 3.
Okay. So, on item number 2, the grant acceptance for the Minnesota State Auto Theft Prevention Grant. Does anybody have any questions or comments? I'll pass it to Councilmember Palmisano.
Mr. Chair, thank you. My computer is doing a full restart here. I did have a couple questions, and I apologize of being a little bit behind the ball in looking at this, but can I just briefly get some understanding as to what that $400,000 will be used for? Will it be used for, like, bait cars? Will it be used for license plate readers? How is it planned for being used? Do you know? Hi, Vicki.
Hi. Chair Chavez, Councilmember Palmisano, Vicki Troswick, Finance Director for MPD. This $400,000, we had applied for 8, excuse me, but we only received 4. Normally we get about 8, and we have ongoing expenses for this program. It pays for the lease. It pays for vehicles. This is not purchasing a bait car. There's some streaming network costs in there. I do have a breakdown of the spreadsheet, but it's fairly long. But it's pays for officer overtime, $40,000 each year. Forensic overtime, $7,800 each year. $4,000 a year in training. The programmatic expenses that I talked about are about $45,000. The rent for the facility is $86,000 per year. And the internet for a bait vehicle, the Axon ALPR system unmarked vehicle ongoing service, 15 a year. Yep.
Thank you. Is it fair to say this is just to continue the things we already do? But this
Yes,
isn't adding
related
anything
to
new?
auto theft prevention.
And the lease, just to understand it, is, or the rent paid is specifically to a specific different office that we operate this from, or shared space somewhere?
Through the chair, Councilmember Palmisano, I'm actually not sure what that is. I would have to follow up.
Sure. I would imagine it might be about using a certain percentage of some other space that we're already using.
I would guess, through the chair, I would guess it is the space for the facility where the office is, as well as the space for the vehicles through
Oh,
property
I see.
services.
Thank you. And then if I may ask, because car theft and it continues to be a problem in our environment, yes, it's gone down overall, but it continues to be a problem. Will we be looking to make up the money that we aren't receiving from the Department of Public Safety in other ways to be able to continue the level of robust work we've been doing in this area, or do we not know yet?
I'm not sure of the impact that we got a lower amount in this grant. I know this grant is, usually we apply every year, so I'm anticipating another application. We would need to supplement with the general fund if we wanted the program as robust as it is today.
Yeah, and you did say that in previous years we got about 800 or 600?
Through the chair, Councilmember Palmisano, 800 for 2 years.
I see. Thank you. This is helpful. Thanks.
Thank you. I'll move this item for approval, seeing that there is no discussion. All those in favor say aye. Aye. Those opposed say nay. Any abstentions? That item carries. Colleagues, next up, we have item number 3, which is authorizing a contract with the Minnesota State Patrol for a joint powers agreement to assist with public safety and security measures. I do have a few comments that I would like to ask MPD and probably our city attorneys for some help on this particular item. I want to know that with this contract with the state of Minnesota, do you know if, and welcome, thanks so much for being here. Do you know if this JPA will require, I'm assuming, the state patrol to follow the city's separation ordinance?
Chair, council members, Deputy Chief John Kingsbury with Patrol. I do not believe so, but I will defer to the city attorneys on that.
City attorneys?
Chair Chavez, may I take a second to look at the agreement? Thank you.
So that is the first question that I had. And as we wait for that, I'll pass it on to Council President Payne.
Thank you, Chair Chavez. I believe the last time this joint powers agreement came up, we had a discussion about whether or not the State Patrol would have to honor some of the provisions of our consent decree. I believe the answer was no, they wouldn't. It's a different jurisdiction. They wouldn't have to be required to follow every single tenant within the consent decree. But we had worked with the city attorney's office to try to do just kind of like a summary of like a principles document of maybe not all provisions of the consent decree, but some of like the main tenets to have incorporated into the MOU. And I'm not sure if that ever actually transpired, because I'm not sure if that joint powers agreement ever came back around. I believe it was Attorney Osborne that worked on that, and I don't know if we have any update on that, if that language got incorporated this time around.
Chair Chavez, Council President Payne, is the question how the JPA, if the JPA incorporates the consent decree at all?
We last time we had a JPA, we worked to incorporate like a subset, kind of one page of principles from the consent decree to have as part of the JPA agreement language, and I'm not sure if that ever made it into this.
I don't see any reference to the consent decree in this JPA.
Okay. I think I would like to, whether it's, and I hate to have you on the spot trying to figure these legal details out. I think I'd like to make a motion to to forward this without recommendation so that we could do a little bit of that legwork, both on the separation and on the consent decree. And so I'm going to move to forward this without recommendation if there's a second.
Second, and I guess those are questions that our city clerks have taken down so we can communicate and give a memo back to the city council. Should we repeat the questions or not?
Chair Chavez, that would be wonderful.
Perfect. The question I had was if this JPA, if our state patrol would be required to follow the city's separation ordinance, and Council President Payne's office was, does this JPA, would it mean that this joint powers agreement would follow our state settlement agreement? And if not, is there work that Council President Payne had communicated, I believe, with the city attorney's office a couple months ago with a similar concern? Has that been met? Okay, good. Okay, next up, Vice Chair Wansley.
Thank you, Chair Chavez. Reason why I'm also supporting Council President Payne's motion to forward without recommendation is just looking at the RCA, and it names that these resources would be used to support special assignments that's related to demonstration response and or large event security. The demonstration response, of course, pops out for me in particular in terms of, I think a number of us on council in response to June 3rd has had a lot of questions around what are the parameters or guardrails in which MPD is following that relates to either the federal consent decree around crowd control and how, that particular thing can either lead to escalation or lead to confusion, and seeing that essentially the crowd control is an opening also here for other law enforcement agencies to either, it sounds like from your questions, either not comply with some of those provisions that are in place was in place through the federal consent decree, makes me a bit concerned. And I think it's best to get a lot more clarity on those things, especially as we're watching how things unfold in Los Angeles before making a decision on this. So I'm hopeful that we can get a staff response providing a little bit more clarity ahead of Thursday. But I just wanted to name that demonstration response, or again, AKA crowd control. This is something that could support MPD with that component, be it related to separation matters or immigration matters or any matter, and want to get more clarity on that.
Next up, we have Councilmember Rainville.
Thank you. I'm going to vote yes for this to advance it without recommendation, but I would just want to caution all of us here on the dais today that public safety is very nuanced and it's very delicate. And we need to support that. We need to protect our community. That did not happen in Los Angeles. We can't let that happen here in Minneapolis. Thank you.
All right, colleagues, anybody else left on queue? On the motion to move this forward without recommendation, all those in favor say aye. Aye. Those opposed say nay. Any abstentions? That has been moved without recommendation. Thank you all so much for being here. All right. Our next item is a discussion and approval of appointments to the Safe and Thriving Communities Work Group. Here to present on this item is Neighborhood Safety Director Amanda Harrington. Welcome.
Good afternoon, Amanda Harrington, Director of Neighborhood Safety, although I am in my role as former Director of Community Safety Design and Implementation for this presentation. Thank you for having me. We are providing the list of individuals that we would like to be appointed for the Safe and Thriving Communities Work Group. Just for some context around this work group, the launch list of the Safe and Thriving Communities report, as well as the governance management and accountability sections, encouraged us to create a community advisory board to shepherd through this work, not only to advise the city on the work, but also to help us with community engagement and enable us to get feedback about the work that we're doing, creating the community safety ecosystem. In 2024, the Office of Community Safety did provide a recommendation to City Council members on a way to create a non-appointed work group. In February 2025, this body approved a work group approach. Actually, it went through the Committee of the Whole and then was approved by the full City Council February 27th. We started recruiting for this work group in April 14th, 2025. And we intended to close the recruitment process May 4th, but we did not have a significant enough number of applicants at that time, so we extended the recruitment until May 18th. We did publicize the recruitment through general media, social media posts, flyers. They were emails out to informal and professional networks. It was included in newsletters, like News Bites, as well as I know it was included from City Council members. So thank you for mentioning that, as well as mentions that we gave at a number of community meetings. The powers as delineated in the resolution approving the work group are as follows, but basically that they will be tracking implementation of recommendations in the Safe and Thriving Communities report, advising the mayor and city council, and then advising us on community engagement around the community safety ecosystem work, but also the creation of community safety centers. We had 30 applicants for this work group. We had a panel of 7 individuals review all of those applications and scored them. The scores were based on the questions that were asked in the application, which is a standard application used for all bodies, community advisory or work group bodies in the city, where we asked about education, training, employment history, volunteer work, reasons that they want to serve on the body, and issues that they believe that the committee should address. We asked the panelists who reviewed the applications to rate based on if those answers were a fit with the scope of the work group. And so people who had answers that said they were focusing on things that were not safety related might have gotten a lower score, for example, because that was outside the scope of what this work group is. This slide shows the nominees that have been selected by city council members. I'm not going to read the names to you unless you really want me to, but it is in limbs. You'll notice that not every ward is included on this page, and that's because not every ward has selected a nominee. There is one individual on the ward list that needs a service restriction waiver because they are involved in another city councilor board. The mayor had 2 seats on this body, and they have made 2 selections. And then we had a number of seats that were reserved for the Office of Community Safety to make recommendations. They were intended to be people that were subject matter experts or had lived experiences with services related to the community safety ecosystem. And so you can see with these seats, we don't just have the seat number, but we've actually specified what their subject matter expertise or lived experience was supposed to be in. For seat 16, we had 3 very strong candidates. One of those individuals had also applied for a ward seat, and so that helped narrow down the pool. All 3 were great. The nominee that the Office of Community Safety is recommending oversees the Next Step program, which is a hospital-based violence intervention program that works out of Hennepin Healthcare. For seat 17, which is a subject matter expert with or lived experience in unarmed violence intervention, we had 1 applicant, and that applicant, Ms. Connie Rhodes, is also an individual that oversees one of our violence interrupter programs through Minneapolis. They are well known to us. They've been doing this work for quite a long time, so are definitely a subject matter expert. Seat 18 had a subject matter expertise or lived experience in restorative justice. For this seat, we had 2 candidates. One of those was nominated by Ward 12, but the other had experience in training as a circle keeper and worked at Seward Longfellow Restorative Justice, so also seemed very appropriate for the seat. In seat 19, we also had 2 candidates. We had conversations with both of those candidates because this seat was for somebody who was just as impacted or had lived experience in the criminal justice system. The general questions that were asked in the application didn't quite do justice to the type of information that we were getting. And so we did speak with both of the applicants. And of the 2 applicants, Joseph, who's recommended, had a bit more direct experience. For seat 21, a young person or advocate for youth, we had 2 applicants. One of the applicants was a young person. We spoke with that individual at the time, and they were considering going to school outside of the state, which would have meant that consistent attendance for this work group would have been very challenging. For that reason, we decided to go with the other applicant. We've since learned that that young person is staying in town, but we had already gone through this RCA process. The other applicant also scored very well. They're a researcher who works for Trial Trends and has done a lot of work, including individual connections with organizations that do safety work with young individuals. So they seem to have deep knowledge about this area. If you approve these nominees, and once they're fully approved, our next step is really onboarding all of the members. We have a very robust training schedule that we are working out, but it includes a number of subjects, including just general ethics training that is required for anybody that is on a city body like this, as well as understanding data practices. We will go in depth on the guiding documents, which means the Safe and Thriving Communities Report, the NYU Asset and Gaps Analysis, but also we would talk about the consent decree and the settlement agreement, because all of those together form the work around the safety ecosystem work. We would also help them better understand the Office of Community Safety, as well as the 5 departments under them, better understanding the community safety ecosystem, what exists currently, and the vision that we're trying to work toward, as well as the community engagement and communications plan, which exists. We'd like them to understand what we've already put together, and then, of course, get their feedback. And then do a deeper dive into the community safety centers, again, the one that does exist, the one that we're creating, and the future in the North Community Safety Center. That will likely take a good portion of the rest of this year. We do anticipate the first meeting being very late in July, and we would meet with this group monthly. We will not just do onboarding, we will also be asking for feedback along the way, but there's quite a bit of information that the group needs to really be steeped in this work and do a good job. I hear about that a lot when I'm out in community, that people are interested, but they might not know the nuances of a lot of the work that we're doing. And we want to make sure that the group that's advising you and the mayor has all of the information they need to do a good job. As I noted, there are some seats that we do not have a recommendation for. Those includes seats 1, 9, and 20. We will recruit for those seats again next spring. It is a one-time-a-year recruitment process that's standard in the city, and so we are following that standard process. We will have quorum with the number of individuals that we have as long as people show up, so I'm not concerned about this body being able to do its work. That concludes my presentation. I stand available for questions.
Thank you, Director Harrington. I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. First, I want to say thank you to staff, Director Harrington, for leading this process, and all the applicants who also are joining in on this process. It's something that's very new. That's going to be really important in guiding our public safety work going forward. I author this resolution in addition with Councilmember Chowdhury and Chair Chavez, mostly with the goal of making sure that residents have the ability to provide input on the city's strategy relating to the Safe and Thriving Communities Plan. And I'm very grateful that now we have that community input coupled with this plan that it very much lays out an extremely clear, specific step-by-step guide on how we can continue to reduce reliance on over-policing measures, using data-backed strategies for how to invest in other public safety initiatives that also meet the needs of our residents. And I'm very excited about this work. You named that it also will be guiding our new kind of facility projects around this as well, related to the community safety center models that we're adopting, the first of which will be opening in Ward 2, be it the South Minneapolis Community Safety Center. And this is going to be a multi-million-dollar investment that really shifts us away from the status quo of how we've not only done public safety, but how we've organized our facilities and assets around a traditional policing model. And I know that's something that my residents were excited to help shape. And this gives them a vehicle to be able to do that work, as well as other residents across the city. So it's my hope that we get more ongoing reports as this body meets, starting in late July, on how we can better show up on our legislative side in backing this work, supporting it, or even becoming aware of what the gaps are. So I just want to say thank you again. Look forward to the outcomes, and for everyone in really believing and supporting in this work.
Thank you for the presentation, Director Harrington, and for the work that staff has done going through the interview process, making sure that there was recruitment. I'm super excited about this work, so I'm just looking forward to learning about what the group comes up with and the type of engagement they have with our city staff. I had a question, not necessarily for you, Director Harrington, but for our city attorney's office, because I know you're following protocol when the only time we can reopen this is in the spring of 2026. However, I think that if there is a way that the city attorneys can walk us through what council action can we take, at least to help get these 3 seats filled before the spring of 2026, if there's anything that the city attorneys can communicate with council on how we can do that, that would be helpful. And if it doesn't have to be today, it can be in a follow-up over a memo, but that at least would be helpful, because I know that Director Harrington is following our procedure, which is reopening again in the spring of 2026. But if there's an opportunity for council to try to figure out how we can fill these seats before then, that would be great.
Chair Chavez, I'm happy to look into that for you and get back.
Thank you. I appreciate it. Oh, that was it. Anybody else, colleagues? All right, so seeing no further questions, I will move approval of this item. All those in favor say aye.
Aye.
Those opposed say nay. Any abstentions? That motion carries. Thank you for the presentation, Director Harrington. Our next item is receiving and filing a presentation from the 2024 Community Health Assessment. Here to present that item is Luisa. Welcome.
Thank you. Good afternoon, Chair Chavez, Vice Chair Wansley, and council members. Thank you for having me. My name is Luisa Brando. I'm Director of Public Health Initiatives with the Minneapolis Health Department, and in that role, I supervise the epidemiology research and evaluation team that is responsible for conducting the community health assessment, which I'll be presenting on. So just a quick overview of what we're going to do. Talk a little bit about what is the community health assessment, or CHA, and how we went through it, how we did it, present results on the different parts of it, and then talk a little bit about what our next steps are. So what is CHA? The CHA, as it states here, is a jurisdictional health assessment that identifies key health needs through a systematic process of data collection and analysis. It is, for us, a state requirement under Statute 145A, because we are a community health board, as well as a requirement for being a accredited public health department, which we also are. In fact, we just got reaccredited earlier this year. And it's conducted every 5 years with small updates in between. And it brings together available information on the health of Minneapolis residents, and then it's used both by the department to guide some of our work and also to support our partners in community in their work. So the CHA it's a large body of work that is made up of smaller pieces of work. And so in our case, we had a context assessment that focused on youth mental health and well-being. Then we have the community, the status assessment, which really is looking at quantitative data, health indicators from the census, from births, deaths, and other health medical records, et cetera. And then also looking at all of those issues in determining, doing a prioritization exercise with community members, with our advisory group, to look at what will we take on. Throughout this whole process, we engaged with community, and we did it with our Public Health Advisory Committee in several times. We did it at the Community Connections Conference, where some of you participated in a discussion that we held, and then also in a joint community engagement with our colleagues at Hennepin Public Health and Bloomington, Edina, Richfield Public Health, since we are 3 jurisdictions that are closely connected and work together. So first, I want to talk to you about the findings from our context assessment, which, as I mentioned, focused on youth mental health and well-being. And we did that because we've heard over and over that youth mental health is a concern in the community. And so we wanted to understand, what do people mean when they say youth mental health? Because you can define mental health in many different ways. Is it diagnosis of mental health issue, or is it isolation and what is it that we were talking about? And so we had 3 questions that we asked, and for this part, most of the work was qualitative data collection. So we had 3 questions that we asked. What do concerns about mental health among young people look for you? What are you already doing, or what is your community already doing around these issues? And if resources, don't think about resources, but if you could do anything to address this issue, what is it that you would do? And we conducted interviews with individuals that were either working in community organizations that were serving youth or working with youth, or government partners that were working in those institutions that work with youth, such as the Minneapolis Public Schools, Youth Coordinating Board, Hennepin County, the State Health Department, et cetera. So these were one-on-one interviews that we conducted with those folks, and then after the analysis, we met with the existing youth groups to validate the results and to say, here's what we heard from the adults that are working with you. What do you have to say about that, and are there things that were missed? So in looking at the results, we put them in 3 buckets: challenges, existing strengths, and then sort of things that youth mentioned. And I'm not going to read all of these, but a couple of things that stood out for challenges: continued impacts of COVID-19, and also trauma exposure, so exposure to violence and other issues. In terms of existing strengths, the fact that there are trusted adult relationships, that youth are building those relationships, as well as having youth-led advisories and initiatives in the city that help youth voices be heard. And then in terms of sort of the youth feedback, some of the themes that came out when we validated these, the need to be able to access alternatives to therapy that are more culturally specific, as well as needing to make sure that youth leaders are empowered to shape policies that affect them directly. So from that, the analysis as well, we had some recommendations at the individual, community, and systemic level. At the individual level, providing safe, judgment-free spaces where youth can express mental health concerns. We heard a lot about the stigma and shame of talking about mental health issues. At a community level, expanding mentorship and intergenerational relationship building programs to have those connections, and at a system level, to really improve the compensation of those working with youth in these areas, so that to maintain, sustain long-term engagement. It's hard to build those relationships and that progress when staff turns over in programs, and so you build those relationships and then someone is gone. So that's the context assessment. I'm now going to provide some information on the health status assessment, and that's really when we're looking at the data, the quantitative data, as opposed to the qualitative information. So for this, we look at what is available, we develop some issue statements, do prioritization, and then we'll bring those up. So the first part was we looked at a bunch of data, we developed issue statements, and with those issue statements, we conducted a prioritization exercises with our Public Health Advisory Committee, and then we had the engagement with the Community Connections. We've condensed, we had about 12 areas of prioritization that we've condensed into 5 because many of them overlapped. For example, immunizations was rated very high as an issue, but we can fit it under infectious disease prevention, infant mortality and maternal health, and adolescent health and well-being. So immunizations can be addressed in any one of those areas and doesn't need to necessarily be just an issue on its own. So it can be folded. So we are trying to combine the issues so we have a smaller number of priorities that we can look at. So some things that from the analysis, some things that we still are noticing. So we continue to see health inequities persist across Minneapolis that which have been driven and continue to be driven by issues like systemic racism, homophobia, and sexism. We also had made some progress in health measures prior to 2020, prior to the COVID pandemic, that we now see some impacts so we had made progress, and then that progress was lost or slowed by the pandemic and lack of access to services because of what was happening. We continue to see the importance of getting city-level data that is disaggregated and that we are able to get down to localized to community level. Often, unfortunately, we are able to get county-level data, but Minneapolis is very different than other parts of Hennepin County, and so having the ability to really disaggregate at the city level is very important. And then we also have heard from our community interactions the appreciation for being able to access the information and access that local level data and having conversations on how to interpret and how to use the information. So we're hopeful to continue to do that and do that as part of our continued engagement as part of our next steps. So I'm going to present some data from 2 of the priority areas, partly because trying to keep the presentation somewhat short. So infant mortality and maternal health. This is a busy slide, but the black line is Minneapolis overall, and we see that our infant mortality rate has stayed fairly consistent over the last few years. The data for 21-23 is not finalized, so we're still waiting to see what that means. But we see that for African American, the infant mortality rate for African Americans continues to be quite a bit higher than for other groups, and unfortunately appears to be rising. And we are not seeing the rate go down, which is what we would like to see, is the rate go down. We also looked at adequacy of prenatal care, which impacts both the maternal health and could have an impact on infant mortality. And we see that while the percent of adequate prenatal care has remained stable, for many groups it's below 50%. So less than 50% of the women are receiving adequate prenatal care. So that is of concern, and it's especially there's some racial ethnic groups for whom those numbers are much lower. We also looked at we have data on other pieces that impact this area, such as presence of opioids at delivery, low birth weight rates, and other measures that impact both mom and baby's health and therefore impact our infant mortality rates. And so we have a lot of information, and we'll be making that available, but just wanted to present a snapshot. The other area of priority is adolescent youth and health and well-being. We had done the context assessment on mental health, so we also looked at medical records, information from medical records on mental health diagnosis. So in Minneapolis, 1 in 6 adolescents that have a medical record that have accessed care in the last 3 years have had a mental health diagnosis, have a mental health diagnosis in that record. And that could be anything from anxiety to bipolar disorder to a depressive disorder. So it runs the gamut. And this is unlikely an underestimate, because not everybody is able to access care. Not everybody would have that diagnosis, even if they are struggling with mental health issues. We also looked at teen pregnancy rate, and which has remained stable, but we are seeing increases in our Hispanic and American Indian community. This is one area that pre-COVID we had made quite a significant process in a reduction of rates, and then, however, since 2019 we've seen for some groups the rate go back up, and so an area for work. And finally, immunizations, which was a priority, and it is of concern because we saw immunization rates drop during COVID because of access and because of all of the issues with access to care during that time, and especially for preventative care. And so we see that only 70% of Minneapolis 6-year-olds are up to date on their childhood vaccinations, and only 43% of adolescents are up to date on their immunization series. And this is of concern, especially with what we're seeing across the country with measles. We'd like to see a 95% immunization rate, for example, for measles, and we only have a 60% for one shot of MMR, and 60% for a complete MMR series, and 80% for one shot. So well below that 95% threshold that we would want to avoid an outbreak. So with that, I just want to give you a little bit of next steps. So, as I mentioned, we have quite a bit of data. We are finalizing write-ups. We are creating a dashboard that will make all of this information publicly available on the city website. We'll be working with IT, but having this data, and then we'll be able to update it regularly, at least once a year. We're also going to be working on our development of our community health improvement plans, which is it's the step that comes after the community health assessment, and we'll work together with Hennepin County and Bloomington Public Health. We do a county-wide community improvement plan. We'll also be focusing on some Minneapolis-specific community improvement plan for areas where it doesn't overlap, where our priorities may be different than, say, Hennepin or Bloomington Public Health. As I mentioned, we're hoping to do more community engagement with the CHA data, so to go to community meetings and present some of the information and hear from community what else they would like to see, or if there's deeper analysis of issues that we can do, and continue to do some of those additional analysis. And that is what I have, and I'm happy to stand for questions.
Thank you, Louisa, for this very helpful and informative presentation to you and the health department. We really appreciate it. I'll see if my colleagues have any questions or comments. Council President Payne.
Thank you, Chair Chavez. We know that public health is under attack at the federal level, and I'm just curious if you have any insights to share, just in terms of especially our partnership with the state and how we can bolster some of those retreats here locally.
So we work very closely with the state health department, and we are all talking about how we can continue to make sure that both local public health and the state public health can work together to ensure that we're maintaining the level of service, and that for all residents. So, but yeah, it's a little scary to see what is happening in some of the decisions, and unclear how they will impact us in the long run.
Well, just know that you have champions in City Council to back you up. So just let us know how things are unfolding.
Thank you.
Yeah.
I put myself on cue too. I think one of the youth feedback that really caught my attention was about the need for safe spaces for youth outside school and home. We consider those third spaces, making sure that our youth have a place to go that is safe, secure, where they can learn, be in community, eat, enjoy their times, and feel secure. And I think I saw one of the recommendations here was about providing safe, judgment-free spaces where youth can express mental health concerns and access appropriate resources. And just in general, I feel like that's part of it, but in general, would love to learn more about like how the city council, the mayor, and we can be more supportive of these third spaces, as health department heard that as a priority or heard that from this assessment from community members, from youth. I see that as one of the kind of the recommendations that you all are seeing on here, and how we can be supportive of those efforts, because I think that is a really important aspect. It's not just MPRB that's supposed to create third spaces for youth. How can the city be more? How can we support the health department, I guess is my question, with these third spaces that are really important.
Thank you, Chair Chavez. I think some of the work that we do with Youth Coordinating Board and with the Minneapolis Public Schools, I'm sure that there will be, so that's not necessarily my area of expertise in terms of implementing the recommendations, but that our group that works with those other partners will be, I know that it is not a new area of trying to figure out how to support those, but I think it's also supporting those in a culturally specific way, and working with community groups that are specifically working with youth to develop some of those spaces.
Thank you, appreciate it. I guess just add us to the list of if the health department needs any support from council on this, I'll speak for myself. I'm very happy to be supportive, because it is helpful to create and improve the life of a young person when they get to adult, when you have a supportive ecosystem. And I was glad to see that reflected in the presentation. So thank you.
The commissioner and deputy commissioner are here, so I'm sure they can follow up with any other thoughts.
Cool. Thank you. And again, as I said, thank you, Luisa, and the health department for this presentation. It was really helpful. Colleagues, is there anybody else on cue? Sounds good. Seeing no further questions, I'll direct the clerk to receive and file that report. And our final item is receiving and filing a quarterly report from the Office of Community Safety and the departments. Here to kick off this item is Commissioner Barnett. Welcome.
Thank you, Mara. Appreciate it. That's good. Good afternoon, Chair Chavez, Council President Payne, Council Member Rainville, Wansley, and Palmisano. Thanks for having me here today. Also with me, of course, as usual, are the department heads for each of the departments under the Office of Community Safety. Excuse me.
And as y'all figure that out, what we'll start with is the Office of Community Safety, and then Safety Design and Implementation. We'll open it up for questions. Then we'll go to MPD. That's the largest presentation of the day, so we'll open it up for questions for that one. And then after that, it's 222. So.
Okay, no problem. Just like I said earlier, Chair Chavez and council members, the Office of Community Safety, of course, has 5 departments under it: 911, Emergency Management, Fire, Neighborhood Safety, and Police. You also know that we have a Director of Administration, Director of Communications, and a Director of Design and Implementation within our office as well. Of course, you've heard it many times before, our mission is to provide a coordinated, comprehensive, and equitable safety service to all residents and visitors. And we work towards a vision that city where all people feel safe, social disparities are eliminated, and all residents can access opportunity and resources. Highlights from Q2. You know that Director Harrington's moved from the position of Director of Design and Implementation and moved into the role of Director of Neighborhood Safety. Also, Chief of Staff Jarrett Jeffries has moved into the role of Deputy Commissioner. Also during the second quarter, which you're also familiar with, is that ALIFA has completed their year one evaluation, and that evaluation has been published. You can find that evaluation on the city's website and also on ALIFA's website as well. We continue to work on integrating those provisions of the consent decree with the settlement agreement. We've been working diligently with all the departments to bring those two documents together to allow us to be efficient and also to work on that, both documents, moving that work forward. Most recently, OCS leaders have attended a conference out east in advancing the fields of alternative responses for 2025. That was a nationwide conference in which jurisdictions from all over the nation got together, and it gave our leaders an opportunity to talk to other leaders around the country to look at how we respond in programs related to behavioral health, livability issues as well. As we look ahead to Q3, like I said before, the work in integrating and implementing the conditions of the consent decree is a priority, and that's something that we will continue to work on. Hiring the replacement for the Chief of Staff and the Director of Design and Implementation is a priority as well. And as reported before, we have planned events throughout this summer, which we continue to work with our justice partners in making those events safe for our residents and for the visitors to the city of Minneapolis. That concludes my portion. I'll hand it over to Director Harrington. Thank you.
Thank you, Commissioner. Welcome, Director Harrington.
Hello again, Amanda Harrington, Director of Neighborhood Safety, but speaking in my prior role as Design and Implementation Director. Just as a reminder, we always have live dashboards about the work and progress that we're making on recommendations from the Safe and Thriving Communities report and NYU asset and gaps analysis that are on the public webpage. Council members, community members, anybody in the city that wants to follow along with this work can see those updates in real time. I will call out that we've completed 9 activities since my last report. Some examples of some of the activities that we did were posting more information about MECC's governance to increase transparency, reviewing communication strategies regarding 311, 911, and related resources. Council members, you received one of the products of that evaluation in that we created information to get out to community about when to call 911, 311, 988, and we're just starting to pass that information out. And we've also been engaging with listening sessions and surveying neighborhood safety employees because some of the recommendations in the report were about hiring and retention of staff in that department in particular. I did want to call out one activity as an example a little bit further. There was a recommendation to consider mandating the use of online reporting for certain crimes. The city did consider that, but ruled out the recommendation. And I think it's important for folks to understand that there are going to be recommendations in the Safe and Thriving Communities report that we choose not to act on, but for good reason. In this case, the Office of Community Safety and the Office of Public Service got together and considered what would be the impacts of doing that. It certainly might decrease the need for police response or the need for 311 agents, but it also wouldn't fit our values of equity. Using online reporting only and no phone call option wouldn't work for all of our community members, including those that speak or read other languages than English, seniors, and the many people that are impacted by the digital divide. So I just wanted to call that out, and we do have our reasons put together for why we did decline that recommendation, and that doesn't happen very often, but it will happen as we go through this process. There are another 78 activities that are in the planning or progress stage, and we continue to make progress on this work, even though the number is down to 2 individuals focusing on this work. Since my attention is primarily focused on neighborhood safety, I'm still trying to continue momentum on some of this work, but there may be some tasks that are delayed until the new director is hired. I don't have much to update for you regarding the South Minneapolis Community Safety Center. WALD is still in their design phase, but with the Lake Street Safety Center, I had previously spoken about some of the metrics that we were capturing around use of that site, and so I wanted to provide an update. Generally, you can see that visitors to the center have increased since we opened in November 2024. I don't have any reasons why they dropped significantly in May. We did host an event yesterday, which Chair Chavez was at, to kind of have a pop-up in the community where we brought service providers outside of the center to promote services that we had inside. We had almost 60 community members stop by our tables and tents yesterday, so we consider that a success. We surveyed those individuals. Most of them had not been to the safety center before, and they told us the reasons were they didn't know that the safety center existed, even though they walked right past it. They didn't know that there were services inside that they needed, or they didn't feel that they needed any of the services inside. We generally got positive feedback that the center did exist, and there was generally a desire for us and the service providers to be more visible. They talked about increased signage, but also just coming out of the center and being on the block. You can see a variety of services that people have come into the center for. This is since the center opened, so this is not a particular month. And we know from my prior reports that there were a lot of people in the beginning looking for outside services, which may have included the dentist office that used to be there. Sometimes it's also Hennepin County Services, which are right across the street. And sometimes people are just curious, quite honestly. We did have our first non-emergency police report recently, so we're excited that that's up and running and that somebody utilized that service. We track a lot of other data about the center, including utilization of the conference room. We've had the conference room that's available to the public checked out 48 times. We do offer a customer survey to anybody who's utilizing the safety center. We have only had one individual take us up on that survey, which is partially why we administered surveys at the event yesterday, so that we could get more information. We also have asked city staff and providers who utilize that space to give us survey information. We only had 5 responses the last time I checked, so we've extended the time that survey will be open so that we can get more information and we can report back at the next time that we're here. Please recall that we had a couple of different goals for this center. One was to serve the community, certainly with services that they needed, but another was also to increase collaboration amongst service providers. And so we've been tracking the service provider utilization of the space. And I will say that our system to track utilization of the space is flawed. Not everybody has to badge in and out, especially when the center is open, so that's not an accurate way to capture it. We've asked people to sign in and out when they come into the center on a QR code. Not everybody does that consistently, so we don't know that we have accurate numbers. But in general, you can see that our partners are in the space weekly, sometimes 2 or 3 times a week. The police department tends to vary. The behavioral crisis response had some issues in the beginning, particularly around the time they had some leadership changes utilizing the space. But since mid-April, we've seen their utilization of the space increase dramatically. So we know that their staff are signing in potentially between calls. It might be also supervisors using that space as a landing pad. We don't track folks who use that center every day, so the 311 customer service agents, the safety ambassadors are not tracked in this. And now I will step aside for an update on pilots from PMI.
Welcome.
Good afternoon, Chair Chavez and council members. My name is Bethlehem Yahalawork, and I am a program manager with Performance Management and Innovation. At the last PHS committee meeting update, we shared the overall goals and design of the community safety pilots, and today's update will focus on key progress and upcoming milestones. The Community Safety Ambassador pilot officially launched on May 28th, with ambassadors now present on the East Lake Street and Franklin Avenue cultural districts. A major milestone with the Community Safety Ambassador pilot has been the full execution of our contract with Metro Youth Diversion Center. The contract includes clear reporting requirements and performance measures to assess ambassador activities and their impact in enhancing overall safety visibility and resources in the area, such as the number of community interactions by type and the number of referrals made by type. Monica Herrera, who was brought on as a public health specialist at NSD, will manage the contract and day-to-day operations of the program. A data tracking tool is also in place to ensure ambassador activities are consistently documented. The activity reports will be regularly reviewed in collaboration with the vendor to ensure quality assurance with data entry. Additionally, we're developing a multilingual community feedback survey that will be accessible via QR code included on postcards that will be shared by ambassadors or on the Community Safety Ambassador webpage. To gather input on both specific interactions and the overall impressions of the program. In May, ambassadors have completed comprehensive training that was facilitated by both the city and the contracted vendor. This collaborative approach ensures alignment with city values, policies, and local context while also leveraging the vendor's field expertise. Our goal is to equip each ambassador with the tools, skills, and resources needed to handle real-world situations with professionalism and empathy. NSD is in the process of hiring a dispatcher to be stationed at the Lake Street Community Safety Center, and the dispatcher will monitor cameras and maintain direct communication with ambassadors and internal city stakeholders to ensure effective information sharing with the appropriate parties. And our goal is to have the dispatcher hired and onboarded by fall of 2025. Looking ahead, NSD will lead operations and provide future updates on the pilot, and PMI will provide support on continuous improvement as needed. After implementation, this transition is representative of PMI's role as internal consultants. After implementation is complete, ownership shifts to the responsible department to ensure continuity, consistency, and long-term success. As we continue to work our way into the implementation phase of the Embedded Social Worker Pilot, a joint powers agreement between the City of Minneapolis and Hennepin County was formally approved by the City Council in February and the County Board in March. Hennepin County and MECC have developed a training program for the social worker, and a workstation has also been set up in the 911 Emergency Communications Center. The social worker position was posted to Hennepin County's job bulletin in May, and we've so far received a total of 14 applications. And the project team will be conducting interviews with candidates this week and next week as well. Key milestones before the pilot is transitioned to MECC include finalizing hiring, training the social worker, and developing a data collection system that's compliant with HIPAA privacy laws. We will rely on the data collected throughout the pilot period to support continuous improvement and to help us better understand capacity needs. Additional data analysis conducted by NYU helped us better understand the proportion of non-injury traffic collisions that required police response. The findings indicated that approximately 11% of these incidents required police action, which aligns with our recommendations that many of these reports can be handled through a civilian response approach. Considering capacity and resource needs, we've also refined the pilot design. 3 traffic control agents will monitor in precincts 3, 4, and 5, the areas with the highest volume of non-injury collisions and longer response times. Assigning 1 traffic control agent per precinct will help improve response times by keeping agents focused within a specific geographic area. This represents an expansion of the pilot area from the original design that we presented in the fall. We've also engaged with civilian crash investigator programs in Charlotte and Wilmington, North Carolina, and a site visit is planned to gain insights into their operations, implementation process, and lessons learned. Insights from those programs will help inform and refine our own protocols and processes to ensure a strong foundation for the pilot. The transit safety pilot is currently in the research and information gathering phase, and so far we've been reviewing best practices and evidence-based approaches used to help inform our direction. We've also had the opportunity to connect with Metro Transit and plan to have future meetings to better understand their current safety strategies and how they collect and use safety-related data. NSD is leading the project management of the pilot, with PMI providing support in data analysis, research, and refining the pilot design. Looking ahead, NSD will provide future updates, and PMI will provide guidance to NSD on data analysis and supplemental information gathering to help inform NSD's decision on the pilot's next steps.
Good afternoon. My name is Kyle. Thank you. My name is Kyle Willman. I am a program manager with the Department of Performance Management and Innovation, and today I'm here to provide an update on the juvenile deflection pilot efforts. Since the last public health and safety update, we've continued to refine pilot design, informed by literature review of best practices and similar programs, including the juvenile redirection program in Longmont, Colorado called Rewind, the juvenile deflection system efforts in Duval County, Florida, and juvenile auto theft prevention efforts locally led by the Hennepin County Attorney's Office. All of these programs demonstrated strong potential to align with Minneapolis pilot outcomes. Insights from these programs will help inform and refine our own protocols and processes to ensure a strong foundation for the pilot. Key pilot design elements include creating unique plans for youth and their families, focusing on services that center engaging youth in positive activities, mentorship, and early intervention, along with an emphasis that this program is not a part of the justice system. Each of these elements prioritizes removal of barriers to avoid the negative effects that the research associates with justice system involvement. This pilot aligns with the prevention work prescribed in the Safe and Thriving Communities report. Our partners, looking forward, our partners in the Office of Community Safety have been briefed on the updated design efforts, and we will reconvene all stakeholders to work collaboratively toward finalizing a design. Additionally, we will continue to engage external stakeholders, like the Hennepin County Attorney's Office, to tailor the pilot to our community safety ecosystem, ensuring this pilot's services build on current efforts and address gaps rather than duplicating the work that is already done. Thank you.
Thank you.
Thank you again for allowing PMI to give updates on these pilots along with the design and implementation updates. I think it's very important for the community to see that this is all part of one community safety ecosystem work. Looking ahead to Q3, design and implementation team will hire a new director of community safety design and implementation, but the team will continue working on pilots, recommendations related to the 2 reports, as well as creation and maintenance of the safety centers. And then a large part of our work will be onboarding the Safe and Thriving Communities work group, which I referred to earlier. That concludes my presentation, and I and the Commissioner are available for questions.
Thank you, Director Harrington, for the presentation as well. Colleagues, we'll open it up for questions. If you want to get on cue, we first have Council President Payne.
Thank you, Chair Chavez. I was just curious on how you're thinking about, for each of our pilots, having a framework for determining whether it's a success or whether we need to reevaluate whether or not we should continue it. BCR, I feel like we got very early, call data from 911 that gave us an indication of the utilization of that program. That was a clear indication that we should continue it. And I'm wondering if you've articulated, what are the signals that we'll be looking for in each of these pilot areas to make sure that they're successful, and if they are not successful, how we might want to reevaluate going forward.
I will defer to PMI staff.
Chair Chavez and Councilmember Payne. So we are, with the pilots, have also identified a number of key performance indicators and measures that we will be relying on that will kind of show us, how the progress is going with these pilots, whether there is areas for refinement that will then support the evaluation of the pilots.
Thank you.
I guess I'm next on cue. Director Harrington, I just want to thank you and staff for the work on the Lake Street Safety Center event that happened yesterday, including Christina and staff and community partners to help put up that pop-up event. I think what I learned is that there is an opportunity to do stuff like that more often because it brings attention to the Lake Street Safety Center. People get to know each other and have conversations with different partners, because I think that's part of the reason the Lake Street Safety Center exists, is to collaborate with different agencies and making sure that we can connect our ecosystem of community safety efforts to make it more effective. So anyways, just want to say thank you to our staff for working on that event. It was fun. I was out there showing bubbles. It was a great time. And also just connecting with our different staff from across different levels of government. So just want to show my appreciation for that component. I had questions on a few things, and it was mostly on the transit safety pilot. So PMI is here as well, but and maybe we'll get more information more later, but is there specifics of like what we're thinking about for that, or is that going to be more later down the road? I know there's conversations with Metro Transit that occurred, but that would love to learn a little bit more about that.
Chair Chavez, I can answer that question.
Perfect.
The transit safety pilot, the impetus of that was an earmark from City Council, Councilmember Chowdhury specifically. There wasn't a lot of detail into the vision of what that service looks like, and so that's why it's really important that we do this research on the front end rather than creating something that we don't actually know is a good fit. And so part of the research that's being done is the conversations that you're talking about with Metro Transit about what are the services that they're already providing so that we could determine if there are gaps and not duplicate efforts. So we don't have a clear vision that's emerged yet. As we delve deeper into the research, I imagine that will emerge.
Perfect. Thank you. Yeah, that's the question I had for that. I think that's really helpful. And I know Councilmember Chowdhury has been talking, you've been talking with Councilmember Chowdhury about it, and she's been really excited about this too. So I think that is all the questions I have. I appreciate it, and thanks for the presentation. And I'm really excited about the pilots programs. That is something that many people in the community have been asking for, these kind of programs to exist. I know that staff is working really hard, and I'm incredibly proud of all of you working really hard on this, so thank you for that. I'll pass it to Vice Chair Wansley.
Thank you, Chair Chavez. I also have to echo the sentiments that you raised. Of course, I'm excited that the pilots were given a progress update, especially as it's building upon the 9% of calls that I think we've already rerouted from MPD and the New York University Policing Project recommendations that said that we could move upwards to 47%. So it just shows that there is so much to explore in terms of how we build out our public safety ecosystem and ensuring that our residents have actual professionals, safety professionals who are equipped to meet them in their moments of crisis and the diversity of crisis that they may have to experience. And I'm excited that we're embedding that into our overall new public system plans and efforts. That said, I did want to get clarification on slide 4, where you reference one of the recommendations that were excluded. It's states here that there are 5. Can you share what the other 4 was?
Oh, thank you, Chair Chavez, Councilor, Vice Chair Wansley. I will have to follow up with you about the ones that were explicitly excluded, but I can tell you, I've mentioned some of those in prior reports to this body. Some of the recommendations were things that had already been done, like to create a restorative justice court that already existed. So we didn't, and I couldn't say that we completed it because we didn't actually do any work on that. The court system had already done it. But I'm happy to follow up with explicitly what those are in a memo.
Yes, awesome. Okay, clerks have that. Thank you for that. And then I did want to just also get clarity on if we're aware of some of these pilots or services might be transitioned over to the South Minneapolis Community Safety Center. I know most firmly in your last presentation, you mentioned there is the goal to identify a service that meets each one of the pillars of our Safe and Thriving Communities plan, from responsive, preventative, restorative, and I'm forgetting the 4th one already, but just trying to think. I know we were going to have a trafficking or anti-trafficking initiative that you all are working on. Yeah, just getting a sense of if any of these other pilots are looking to be embedded into that particular work too.
Chair Chavez, Vice Chair Wansley, the pilots that we have talked about today, many of them are intended to be in the community instead of operating specifically out of a building. So community safety ambassadors are a great example. We don't want somebody to walk into the safety center to see a community ambassador. We want to see them actually on the street. That being said, we are creating the dispatch center at the South Minneapolis Community Safety Center. So that's a place where they can check in and out, get their information for the day, get their technology to communicate with folks, and then go out into the community. It's also a great resource for restrooms and breaks and things like that. But similarly with the traffic pilot, we want them to be out in the street responding to calls. The 911 social worker should be in 911, which is downtown. The transit safety pilot is unknown since we're in that research stage, and the juvenile deflection pilot, I think, is also an unknown because I've said before, there might be services that we already have existing that we would utilize for that, and they may have their own locations, but there may also be a desire or an openness for them to have a presence in the safety center. So we'll have to dig further into that pilot before we know. But there certainly will be services in each of the categories: prevention, response, and restoration in the center.
Okay. Awesome. Those are all the questions that I had. And again, thank you, Chair Chavez, for continuously providing space for us to amplify. I think this particular work and seeing the ways in which the investments that the council has brought forward, I'm thinking of particularly with safety ambassadors and those related to transit safety too, are being advanced, and seeing that ongoing development, because these programs were not always safe and sometimes up for the cutting block. So it's great to, again, assure our residents that the investments that we're bringing forward, that's in alignment with the recommendations that have been shared with us, that work is ongoing and can positively report out on that to our residents. And then they can see it, like the safety ambassadors. I know folks in my ward or around Seward are super excited to see this resource come into the community. So with that, thank you.
Awesome. Nobody else is on queue. Thank you so much for the presentation. We really appreciate that part of the component. Next up, we have the Minneapolis Police Department. Welcome.
Hi, Chair, council members. Katie Blackwell, Assistant Chief of Operations, and here to give you an overview on this Q2 highlights. So here's some crime numbers for robberies, carjackings, and auto thefts, just to touch on a couple that are down across the city. 36% reduction in overall robberies, 35% reduction in carjackings, 26% reduction in gunshot wound victims, and then 40% reduction in auto thefts. So this is a year-to-date comparison median response times to priority 1 calls. This is from January 1st through May 31st year-to-date. And I don't want to insult anyone's intelligence. I think most people know what priority 1s, but in case somebody doesn't, priority 1s are very urgent calls that are usually inactive in progress, just below a help call. we're responding to protect people or property. So these are broken down by precinct. This is average, and citywide, the average is 8 minutes and 29 seconds that police officers respond to these priority 1 calls. So this is a historical citywide priority 1 median response time, same time frame year-to-date comparison that the slide I just showed you. And this is broken down from 2019 currently through 2025 throughout the years. And so you can see the numbers are slowly improving. We're not quite at the response times when we're fully staffed, but we're slowly increasing those time gaps. So we just recently had a recruit and lateral graduation ceremony, May 21st in North Minneapolis, and we welcomed 17 new officers, 11 were recruits, and 6 were laterals. We're doing a number of these ceremonies throughout, whether it's promotion ceremonies, welcoming, or graduations throughout the city. There's a lot of community members that it's kind of nice, especially the welcoming ceremonies, that are able to meet the new laterals, interns, recruits, cadets. And then recruiting and hiring. I want to thank council members for supporting us in getting 2 civilian bureau chiefs. Bureau Chief Ayodele Fomadou and Ganesha Martin started with us. They're wonderful. Then we also had a recruit class. It says 36. It's actually 38 recruits that began on June 4th. And it's been the largest class since the 1990s. And right now, our sworn staffing has just topped over 600 officers. It's first time since early February 2023. So we're heading in the right direction. And then past the piece, we had a large community event held on April 29th at Phelps Field Park. It's probably the most significant community event we held this year. It brought a lot of police and community together, a lot of collaborating with community groups from the Police Community Relationship Council, NAACP, with Minneapolis Unity Community Mediation Team, the Black Churches, the 38th Street Business Association, and other organizations and leaders. And then we had a lot of events in May to honor Officer Jamal Mitchell for National Police Week out in Washington, D.C. The joint Hennepin County Minneapolis Memorial Service, May 23rd. And then we had the 1-year anniversary, May 30th. We had a family event in Zimmerman, and then we had a service at the 5th Precinct. And then looking ahead, we had a promotion ceremony yesterday or last night, and then we have Academy graduation September 25th. That will be the 38 recruits that are currently just started. And then we have a permanent memorial at the 5th Precinct for Jamal Mitchell coming up. And then a big highlight is training of the use of force policy. This is a really huge undertaking for the training division. So part 1, we have 3 days that of use of force training, and part 1 is completed, part 2 is in progress, and part 3 is upcoming. This policy goes in effect in August. And I think the biggest change is that really a big emphasis not only in policy, but in training is the emphasis on critical decision-making, using every feasible de-escalation and tactics to slow things down and communicate. With that, pending any of your questions.
Thank you so much for the presentation. I'm going to ask my colleagues to see if they want to get on cue, if they have particular questions or comments. I'll first pass it to Vice Chair Wansley.
Thank you, Chair Chavez. I actually just have more of a comment just related to slide number 19 that offered additional details about response times. I know this is something that I inquired about when planning this presentation for today's committee. I know I've gotten significant feedback from constituents wondering the correlation of response times to having an on-site police precinct in the neighborhood. And just, it was interesting to see here that the response times within the 3rd precinct, where I represent, is also in line with response times for the 2nd and 5th precinct, as well as the city wide rates that were shown too. And I again wanted to highlight that this actually also pointed out that there might not necessarily be a correlation. I don't know in terms of what can lead to that type of discrepancy. Like, for instance, here, seeing the 4th precinct, they have the slightly below average response time, and they do have that physical precinct. So not sure what's relating to that, but I know oftentimes I hear that of like, is there a correlation to that with the South Minneapolis Community Safety Center that's still in progress, and just seeing now having accurate data to show we're actually in line with citywide trends, and also looking at data has shown kind of a difference here around the 4th precinct. So I just wanted to flag that, and thank you all for offering that more accurate updating around response times.
Thanks, Councilmember.
Anybody have any questions? Otherwise, I think one thing I'd like to get a follow-up would be more on the crime statistics year-to-date on a precinct level. And I know we can search that up ourselves. I think at the next presentation, maybe what would be helpful is, I think seeing those highlights is great, and then also maybe at a precinct level breakdown, or even just a follow-up, that would be great.
I can do that, Chair.
Perfect. Thanks so much. Next up, we have Councilmember Rainville.
Thank you. Thank you for the presentation, but I just want to pass on the note of gratitude I have for the response that the police department had at the mass shooting last Saturday night in Boom Island Park. In fact, to my knowledge, that's the largest shooting we've had in the city of Minneapolis. And unfortunately, I live right by there, so I went down there. And as I got there, the brave police department, both Minneapolis Police and the Park Board Police, were escorting the brave firefighters into this chaotic scene, and it immediately started to triage the wounded, tend to the woman who eventually passed. And there was a police police officer who put a chest seal on, thus saving the life of another person. And I just cannot imagine the bravery it takes and the training and the skill to go into a mass shooting like that all that chaos, and present order and calm it down and do that work. So please pass that on to everybody involved, to the whole department. And Chief, I won't go in queue when you're up, but I wanted to thank you as well. And if you could pass on to firefighters, always remember that fire truck following the police cars in to deal with all those poor wounded people. Thank you.
Thanks, Councilmember Rainville.
Thank you, Councilmember Rainville. Vice Chair Wansley.
Thank you, Chair Chavez. I actually wanted to also get clarification on who within MPD, or is it within OCS, that is tracking any data related to the embedded social workers?
Chair, Councilmember Wansley, is in terms of just referrals, or how many that are coming in?
Yeah, the overall program. I think this is something I've been inquiring about for almost a year now. It's great to see, in other programs, we're getting a little bit more specific data in terms of if it's referrals, how that's addressing either calls to service, like reducing the repeat calls. I know that's anecdotal information that's been shared by the 3rd Precinct Inspector at community meetings, but this has been a program where it's been challenging to get concrete data on how it's also helping, and wanting to get a sense of where that's being tracked.
Councilmember Wansley, that's a great question. We have a commander that's in charge of liaisoning with the embedded social workers and different programs. I can get those statistics. They are a little tricky and complex sometimes, because we just recently, a month ago, connected with the county that said they had so many referrals, and it seemed really low, and I told them that the police officers and inspectors actually will remark at how many times they reach out to social workers, and so when they make a referral to those embedded social workers at the precinct, quite frequently, the referrals that they were counting were not always the police officer referrals. It was the referrals that they were able to get help from. So we'll try to get the referrals broken down better, of how many police referrals we're giving, and how much resources they're getting help from outside in the county.
Yeah, and the types of referrals too, if it's around mental health, like what's the categories of the referrals that's also being made by officers via this program. So, yeah.
Thank you. Great question.
Thank you. That is it.
Thank you.
Thanks for being here. We appreciate your help. Next up, we have the Emergency Management Department, and we have Director Sayers. Welcome.
Good afternoon. I am Rachel Sayer, the Director of the Emergency Management Department. So today I wanted to do something slightly different. When I first met you all sometime late last year, I heard from all of you, you really wanted me to come back and reflect what I heard and where I was going to take the department after my first months on the job, listening, reflecting, really figuring out where we should be heading to meet the moment for emergency management as a city. So I'm here today to reflect to you what I've heard and where we're going. So let me start by just saying this is our revamped mission. It is really just to clarify what we do as a department. So Emergency Management Department prepares the whole community for disasters, and we coordinate the city's response. And hopefully you're already starting to see a little bit of that from us over the last few months. But those are the two big things we do. We prepare the whole community of the city, and we coordinate the response. So in terms of foundational aspects of what emergency management does, we have several nationwide resources, including something called the National Fire Protection Association Standards. That just defines what emergency management programs should look like. So that is what we are aligned to, and that's how we know that we have the components of a program that we should. We, of course, also look at and refer to the Title VI in Minneapolis Court of Ordinances, which refers specifically to emergency management. And we have our council-approved emergency operations plan. That is reviewed and approved by you all every 4 to 5 years. So the next time that will be up for renewal will be early next year. We also use something called the National Incident Management System. And this is, again, a nationwide system so that all emergency responders, emergency management professionals, are speaking the same language so that when a disaster escalates, we can all plug in and work together quickly. We all have the same systems, we speak the same language. So we use that here, and that's a really key component of how we do response. We, of course, are feeding into and a part of the safety ecosystem work as well. Really, for us, that is back to the preparation. When we help people be more prepared for disasters, we overall help our community be safer. As a department, a few of the things we're also focusing on moving forward is being really people-focused. In disaster response, sometimes you can have a lot of focus on a hazard, how do we control a hazard? But what we're focusing now is really coming from my humanitarian background, which is around what are the impacts that the people in our community and city are experiencing and centering our work there. So that is going to be threaded and has already been threaded through all of the programs and work that we do, and you will hear that from me often. We also, of course, want to ensure that the actions we're taking are not creating unintentional harm. So this is a really key principle, again, stemming from my humanitarian background, that we make sure to implement through all of our programs. We want to make sure that if we ever have to support setting up a mass shelter, for example, that we have the components there that will make sure that people are safe and that doesn't unintentionally put them in harm's way. Of course, to do our job well, we need to collaborate, so that's an underpinning principle of our department. And in terms of sustainability, we are a small department. We are really just us, our people in the department, getting the work done. We don't have, extra resources, so for us, when we design programs and think about what we're doing, we are from the start thinking about sustainability. How can we make sure that just us as the individuals in this department can get this work done? So we have 3 really big mission areas as a department: preparedness, response, recovery. We have many programs within this, and again, these are all people in my department powered programs, and I'm just going to touch on a few key ones of these just to illustrate what we do as a department. So for preparedness, we work on contingency planning. So when there's a significant hazard that's identified, wherever that source is identified from, we go into high gear for contingency planning. We're coordinating across the city departments, we're identifying risks and hazards, and then we're planning to mitigate and prepare for those risks and hazards. And then that plan really stays in place, and it is fed from the emergency operations plan that you all, every few years see as well. We are also holding ongoing and regular exercises. Exercises is how we basically test ourselves. It's how we know that we are following that national standard of how we should be responding. And those exercises, we hold them enterprise-wide at least twice a year. In the response mission area, a few things I just want to call out is that our department manages and maintains the city's sirens, the early warning sirens. And that we, of course, run the Emergency Operations Center, which is the city's coordination hub for response if it needs to be stood up. So we've also done work in the last few months defining where we're going. And I just want to clarify, this is, not metrics-based because it is a vision, but we are working on metrics behind this so we can figure out make sure we are making progress. So we want our department to be a national leader in reducing vulnerability and increasing resilience to disasters. That is our vision for what we want to accomplish as a department for the city. So moving now into the outlook for the coming year, for sure. We are constantly monitoring hazards. As I mentioned, I think in the last quarter, as we're seeing now, smoke, air quality, significant hazard I would expect for us to see throughout the summer. Severe weather, this is always going to be a hazard, and we're in the season now. When we look at the operational landscape, that is changing for all of us, and for specifically emergency responders, we're talking about the level of federal funding available for disaster response. So we do anticipate those levels to change, and what that means is that the ability of our city to apply for disaster assistance will be significantly reduced if those levels are changed as we expect them to be. That means, again, we just need to put more time into preparedness, because if we're not going to have the funding for recovery, everything we can do to mitigate and prepare in advance is going to help us come out better on the other end. We do expect to see deepening needs. This is around, of course, rising costs, all the various social programs, health concerns. Ultimately what this means at a household individual level is harder choices around more and more basic needs, especially for our most vulnerable residents. In terms of outlook around monitoring systems, so we do know that our national ability to understand hazards around severe weather is degraded at the moment. There are fewer high altitude weather balloon releases, and what that means for us is that we just might not have as good of a heads up as we used to on when severe weather is about to roll in and hit us. That is just a reality. And of course, in this outlook is the general uncertainty. And that uncertainty can, of course, wear on people over time, as well as institutions. And really what it means for us in emergency preparedness is that there's a wider range of scenarios and hazards that we need to be prepared for than previously. So when we look at different levers for how to engage with this outlook that I just walked us through, we really have 4 different levers that are available to us in varying degrees. And I'm going to talk through each of these briefly now. So the first thing that we are doing in this department is shifting our focus, as I mentioned earlier, from the thing that happens, so away from the hazard and to the people that they happen to. This really means that this will help us focus on how we mitigate the impacts rather than the hazards. So this is, again, getting us to that point of how we help people be less vulnerable and more resilient by focusing on the impacts that they will feel rather than the hazard will bring. Another lever we have is preparedness outreach. And so what this means is that how I've had success doing this in other contexts is really thinking about the different segments of our city and communities and then tailoring our approach to each of these groups. So the risks and the strengths that each of these groups bring are different, and the more we can tailor preparedness efforts to each of these groups, the better prepared that group is going to be to face a disaster. So the risks and strengths that a household have, we want to build on those and help households be more prepared for disasters. And same thing with local businesses. The hazards they face are different and unique, and the strengths they have are different and unique, and we're going to build on those. We, of course, want to really focus as well on community organizations because they are, trusted links and the links for some of our most vulnerable community members. And we want to help them make sure that they're able to continue doing their critical work regardless of the hazard that we're facing. So this all to say, this is a long process, getting us to that vision of improved resilience and decreased vulnerability for this city. The point we're at is really this beginning point. We want everyone to be aware that it's even possible to have a plan for preparedness. So when we look at those targeted groups, this is the kind of methodology, this is also called a customer journey, it's just tailored for emergency management, that we will be taking into consideration different methodologies as we move the different parts of our community along this spectrum. So eventually what we hope to get to is, households saying, I've got my plan, I exercise it, I'm in good shape. Hey neighbor, do you have one too? Because that's ultimately how we get to a more resilient and decreased vulnerable community, is that whole neighborhoods, whole communities have shared plans and expectations. Another lever that we are using is around ecosystem coordination, and I have talked about this a little bit in previous committee meetings. So one thing here we're doing is Community Lifeline partner calls. So Community Lifelines is a terminology, again, that is a national-wide term that is referring to critical infrastructure for our city. So whether that's our, communication systems, our infrastructure systems, making sure that everyone who works in the emergency preparedness space is connected so that when a disaster happens, we can easily get going and working on getting those critical lifelines, those critical infrastructure components back up and running so that we can continue for our critical services. So we're having regular calls with those different points of contact to make sure we're all tracking the same kind of hazards and prepared for the same kind of hazards. The other thing we're doing is this 3W, who, what, which organizations are providing what services where. This is something I've talked about previously. We have made progress on a project plan and initial engagements, and what we're really focused on now is figuring out the boundaries of an initial, what we would pursue to create a pilot of this tool, and then go through proof of concept and all of these steps. So we're making progress. Again, that's like a year-long project to get to. But that is something that we believe will help us ultimately respond quicker as a whole ecosystem to disasters. The other project that we're making good headway on is around predefining triggers for severe weather so that if there is, for example, a super extreme heat day, we hit that temperature trigger, now we're going to send out these communications so that everyone has a better understanding of the risks they face. So as I mentioned, this is a long process, and we are developing this into, we're approaching this in basically by-year plans. So this year we're really focusing on just laying the foundation, which is around closing some critical gaps. One of these is Ready Camp. I've mentioned this before. We identified Ready Camp was a 6-hour, a little bit less accessible than we'd want program. We are revamping it to 1 hour. We've already had outreach and interest to start delivering that, and once we have our new community engagement person on board, they will help with delivering that. Another key gap that we've identified is incident command system for senior leaders. That is a training program that is pretty individualized, but just so everyone understands their role in an emergency. Another priority for this year is just clarifying who we are for everyone. I heard that consistently in my conversation is, what does your department do? What is your role? So this, coming to you and talking about this is part of what we're doing, and we're doing that across the enterprise. And then finally, we have been working across the enterprise to understand what data we already have to help put in place a picture of where we should be focusing our work, again with that lens of focusing on our most vulnerable communities first. So when you'll hear from the Emergency Management Department, frequently, I think is the bottom line based on recently. But we will, that incident command training that I mentioned on the last slide, that is something that I do want to come to you all and give you training on, as well as I believe now a NIMS training as well. You will hear from us for briefings and communication during emergencies. And for our community, we really encourage everyone to sign up for the Smart 911 alerts. That's on the city website. That is how you can get those emergency alerts when the situation is really about safety and severe. Cash is best. I just want to mention this is really critical that when we do have disaster responses, something in my experience is really common is people want to help, they want to provide, food, clothing, things like that, but we need to make sure that doesn't get in the way of the first responders. So in a disaster, cash is best. Are there local organizations who are doing work that you can support? That's the best thing you can do when a disaster happens. And then finally, we are, as I mentioned, revamping our outreach efforts such as Ready Camp that will be available much broader later this year. That's it.
And Dr. Sayer, I think because it was a longer presentation, maybe I'll ask my colleagues if they do have any questions for you. We first have Councilmember Palmisano.
Thank you, Mr. Chair. Thank you, Ms. Sayers, Director Sayers, for this presentation. Part of this new look at emergency management is about the time we're living in, whether it's climate change and the impacts or the political headwinds of today. Part of these changes is about, I think, as a city, where we're going and evolving is having been through so many events in overlapping ways, particularly in 2020, and about figuring out where we go from there, having the after-action review that we saw a couple years ago and taking those recommendations very seriously, and now being, we clearly are following the recommendations that had been in that review to learn from our past. Part of this is about being NIMS ready. Part of this is about being less siloed as you're part of this other larger briefing today. And some of the methodology that I have seen you incorporate and share here is new to us too. But part of this is leadership. And I've found your department's fresh energy here to be a great match for where our city is at right now in the work that we're trying to do and get together a complete public safety ecosystem. And I'm just so glad you're here, and I'm so glad that your team has this approach, this kind of refreshed approach, and hooking into all these other parts of the city and administration. I've really appreciated my briefings from you. I feel very confident in our ability to do emergency communications and management, and I'm sure I'm not speaking just for myself when I say that. So thank you so much for being here and for bringing this department this sort of lens and energy as we go into this era together.
Thank you.
Yeah, and again, thank you for Director Sayer. Thank you for the presentation or the briefing you are providing to city council members, and the briefing today, I think, bringing in city council members that work directly with constituents, community members, people that are directly impacted, and having the ability to share feedback from the people that we represent is something that is important. So I do want to appreciate your willingness and your support in engaging us, because that's engaging our constituents. So I at least want to say my appreciations for that. Nobody else is on cue, so just thank you for this presentation, and we appreciate the updates.
Thank you.
Next up, we have the Minneapolis Fire Department, Chief Tyner.
All right, good afternoon, Chair Chavez and members of the committee. So I always like to start out by reading our mission statement, and I know you guys have heard it many times now, but there may be somebody in the audience or somebody watching this broadcast that may be hearing it for the first time, so that's why I read it every time. Employees of the Minneapolis Fire Department are thoroughly trained and ready to protect lives, property, and the environment by rapidly responding to emergencies and hazardous conditions. We are committed to prevention by proactively working with the community to reduce the risk to life, property, and the environment. Our motto is serving the community and enriching the city. Quarter 2 highlights. We graduated our 2025 cohort of the MFD EMS Pathways Academy, a program I'm very proud of. They graduated on May 30th. We had 18 interns that completed the internship and have either obtained or in the process of obtaining their emergency medical technician certification. I think the last update I got is that 16 of them have tested and 2 of them are still waiting to test. Those tests have to be individually scheduled with the state, so it takes a little while. In preparation for employment in the EMS fields, like paramedic, EMT, and even firefighter, and even EMS dispatcher. As you know, behavioral crisis response was transferred to fire, and we continue the process of developing an effective partnership with Canopy Roots, and I think that's going well. And we completed the RFP process. Well, we haven't selected a vendor yet, but we have completed the process of getting bids to begin the upgrade of the fire station alerting systems. Some other quarter 2 highlights is we've completed the development and implementation of the Image Trend Fire Incident Reporting System to replace our old outdated system. We're beginning training now on the system, and that should go live August 5th. We've completed the civil service promotional exams for for battalion chief, and we have 2 open spots currently that we will be promoting as soon as we get through the challenge period. And in partnership with health, we've placed a Narcan vending machine at Fire Station 14 in partnership with the health department. So looking ahead to quarter 3, we're going to be doing promotional testing for fire captain and also promotional fire processes for deputy chief and staff captain. We are required by contract to open those positions up every 2 years, and so this is the year we're doing that. I talked about Image Trend software. We're doing our training, and our go live will be in the 3rd quarter. And installation of the first fire station alerting system upgrade at Fire 6 should happen in the 3rd quarter. And a couple of things that I actually forgot to put on there is we are also looking to expand the Mari Safe Stations program to Fire Station 7 on the south side in the 3rd quarter. And we'll be graduating a class of fire cadets on August 4th. And I think that's it for fire. So
thank you, Chief Tyner. And I'll ask our colleagues to see if there's any questions, just so you can get going. Anybody have any questions?
Okay. Thank you.
Thank you for being here, Chief. Next up, we have the Neighborhood Safety Department. I assume Director Harrington is back up. And then we'll have 911.
I am back. Amanda Harrington, Director of Neighborhood Safety. The quarter 2 has been spent focusing on the objectives that we're really trying to get the department fully staffed, getting invoices paid appropriately, new contracts implemented, and contracts having or including metrics and data collection points identified. We've made progress on all of the quarter two objectives. I will address staffing more on the next slide, but I do want to say invoices certainly are being paid. You had gotten the update previously that the 2024 invoices had been paid. I want to acknowledge it can still be challenging to get the information that we need to pay the invoices quickly, and I know that is a struggle and a pain point for community organizations. As good stewards of taxpayer dollars, we have to ensure that the evidence provided by the vendors matches the invoices that they're submitting. And while some of the vendors that we work with have sophisticated systems where they can track employee check-in and check-out and expenses, others, as you know, are smaller organizations, and that can be more of a challenge. We have trained all of the vendors. We continue to train new vendors, and we're working to support each vendor where they're at. That can be a timely process, but it's important to us that we meet each vendor with their particular situation. With the new contracts, we certainly are executing contracts, and I acknowledge it's not at the rate of speed that any of us wanted or hoped for. I think you can tell that by the start dates that we have put on some contracts, that we expected it to be sooner. Deputy Director Leah Lakes reported on many of the contracts last week during Committee of the Whole, so I'm not going to return to that, and we're working on answering questions that came up during that presentation in a response memo. But I think it's important to call out, since this is my first time giving an update on behalf of this department, that what I've seen is that the department is working incredibly hard to balance the requirements of their lawsuit settlement agreement, the desire including from this body, to implement best practices, which our national partners are advising us on, to be responsible to vendors during negotiations, and the urgency to get services started. Sometimes those are in conflict, and they're all equally important. All of our new contracts have metrics that are consistently built in. Some of the examples, YGBI contract requires monthly reporting to track program activities and outputs, and quarterly reports that track participant progress and outcomes. Minneapolis includes entering data into the Cure Violence database, which documents all program activity, including but not limited to conflict response, participant screenings, case management, and our safety ambassadors, which was referred to earlier, are piloting results-based contracting. Our department is almost fully staffed, which is amazing. From when I started with OCS a year and a half ago, it didn't feel like that was possible. So Deputy Director Leah Lakes and the team at NSD have done a really amazing job getting out job postings that are right for the department, interviewing applicants, getting them onboarded. There are 2 positions currently that are posted, the Community Safety Specialist and GBI Case Manager. I believe we have interviews this week for the Community Safety Specialist, and the other position is still accepting applications. There are 2 positions that I've placed on hold. I asked to hold off on those positions while I get a better sense of the department's needs. As you know, I started just slightly over a month ago, and I'm still getting a better sense of what we need related to those 2 specific positions. Some other highlights from quarter 2, there are a couple of RFPs in progress. You referred to earlier, Vice Chair Wansley, the human trafficking RFP related to the South Minneapolis Community Safety Center. Those proposals have been reviewed by the panel, and we're moving to work with procurement on next steps. The Violence Prevention Master Contract proposals have also been reviewed, and we're working with procurement and civil rights on those next steps. We plan to bring the contracts before City Council, particularly with the master contract, in groups as they're ready, so that the ones that are most ready, we can get started and get those services off and running. Some of the others might need a little more support with some of the requirements, and so we will get those to you in batches. We'll also be coming before City Council at some point soon for the contract with NNSC, otherwise referred to as John Jay. As a reminder, that supports our GBI work, and I recently met with Director Sasha Cotton, which I found an incredibly helpful and supportive conversation, and I'm looking forward to our ongoing work with them. We're also working on contract extensions for violence prevention services. Those are not an increase in funds, but to give some of the vendors more time to do the work that we actually contracted with them to do, as well as Touch Outreach's YGBI services, which is in the same boat. I will also note that at the end of May, after I had started, I reached out to all vendors in neighborhood safety to schedule introductory meetings because I feel like it's important for me to get a better sense of their experience contracting with our department. And so those meetings, a couple of them have taken place, but most of them are getting scheduled as we speak. Looking ahead, I've asked to shift our priorities. I've introduced kind of the buckets that match priorities with the Office of Community Safety of collaboration, data collection and use, and transparency. We're still focusing on executing contracts and starting services. I feel that that belongs really easily under the collaboration bucket. For data collection, we're ensuring training. So we now have metrics built into the contracts. We need to ensure that the vendors are trained to collect that information with fidelity. And then we also need to use data to make decisions about services in the future. So as we're looking at RFPs or any additional pilots, making sure all of that's based on data that's available. And then along with transparency, that's talking about updating our web pages. Some of those are a little dated, and so we need to update those for current programs. We've been working with our communications team on that to get new photos and help us update the content on those pages, in addition to sometimes creating new pages like for the Safety Ambassador pilot. We also need to get out dashboards. So once we collect the information, it's not just for us to sit on. We also need to share that out transparently with community, and so that'll take a little bit of time to create those dashboards, but we'll be adding those to our updated web pages as well. And now that we have more staff on board, people don't need to do multiple jobs, we're starting to flush out everybody's specific work plans. This is going to help us create role clarity, ensure that everybody is working on the same priorities, but also at the appropriate level, and hopefully help with staff retention. Our new director of programming has also been working on a process for how to activate vendors that were selected under the master contract, and at the same time, we're negotiating with those vendors, as I said, and we'll be submitting RCAs for City Council. That concludes my presentation.
Thank you. We appreciate it. Next up, we have Director Hodney, and then we're done. Welcome.
Thank you. Good afternoon, Chair Chavez, council members. I always try to make it quick and brief for you, as I'm usually the last one up here. So I too like to start with our mission statement to remind the public of what 911 is here for. Staff of the Minneapolis Emergency Communications Center help save lives, protect property, and assist the public in their time of need. We achieved this by providing the critical link between public safety responders and the communities we serve by being efficient, courteous, and compassionate. Some of our Q2 highlights is the total number of calls that we've received from January 1st through May 30th has already been 238,984 calls. This is a 0.8% decrease from the number of calls for the same quarters last year. With our staffing stabilizing and the increased staffing, we're starting to see a reduction in our overtime needs. This has resulted so far this year in a substantial $195,000 cost reduction compared to the amount of overtime we were paying in 2024 during the same time period. The increased staffing is not only reducing overtime needs, but also significantly alleviating the pressure on our staff, giving them more of a work-life balance. Radio communication was moved over to encryption in May. This enabled us to comply with state and federal regulations and provided a safer method to maintain confidentiality of private information. The development of a new dashboard allowing public transparency was also launched in May. This dashboard, which can be accessed by the public, provides updates on 911 call minutes after 30 minutes of entry into the system. The radio shop is also focused on completing communication setup at the location of the new first precinct to ensure there can be phone and radio transmissions on all levels of the building. Looking ahead into the third quarter, over these next few summer months, MECC sees an increase in call volume and radio activity, so the public safety telecommunicators are focused with their energy on getting those calls processed. Our training team does a little bit of a change during the summer months because we're unable to take staff off of the floor for extended training. They start doing short training bulletins and videos to help support and continue training and education for the 911 staff. The Embedded Social Worker Pilot Program is started interviews this week. We'll be continuing those into next week in partnership with Hennepin County. And once that's done, we'll get the trainings going and hope to have the social worker in the 911 center by summer's end. Just a few of the summertime community events we're getting involved in is with Pride, precinct open houses, open streets, and several other community events that we have been invited to and have found very valuable to talk to the public about when to call 911 versus when to call 311. The radio shop work will begin on the new Southside Community Center to ensure there is cell phone and radio coverage throughout that building. And the radio shop is also working on the public safety statewide radio systems platform to ensure that we have the software upgrades that we need to as we move into the next phases of radio communication in the future. That concludes my presentation.
Thank you. And now we'll open it up to our colleagues that may have some questions. First up, we have Vice Chair Wansley.
Thank you, Chair Chavez. I did just have some follow-up questions for the Neighborhood Safety Department presentation. So just, thank you, Director Harrington. Going back to slide 47, I thought a few months ago the GBI and YGBI program manager had been hired, but now it's saying that it's in progress. So did someone occupy this position for a brief period of time? Or yeah, what happened with that?
Chair Chavez, Vice Chair Wansley, I'll have to follow up on that. I know that we have somebody working on that GBI position now, but they are, that's not what they were hired to do. It was important in our department, and they are willing and able to fill that role until we have a permanent person in place. We did not have the GBI case manager. I know we didn't have that position in place because that person is intended to do direct service alongside of the vendors that we have.
For GB, so are those two separate? Because the way that it's always been presented as the program, or now is framed here as case manager, would oversee or support both of those programs, GBI and YGBI. So I think the initial conversations that we had back even going in February and March, where there was concerns around the vacancy, I think there was a presentation that noted that this position was filled, like someone was actually hired. So that's why I don't recall interim staff person being mentioned. It sounded like it was a full-time person. So that's why I was surprised to see the in-progress piece. Yeah.
Chair Chavez, Vice Chair Wansley, I'll have to follow up on that because that was before my time and I don't want to misspeak.
Okay. So that's a clerk. Thank you, clerk. You got it. And then also, I did want to get a sense, because these contracts expire in August, like what's going to happen with the community trauma response program. I know that's like that's separate from the violence prevention master contract, but that was its own separate thing for many years within NSD or OVP. So yeah, I just wanted to get a sense of what was going to happen with that.
Chair Chavez, Vice Chair Wansley, we are looking at those community trauma response. They will remain separate, and so we're trying to determine right now how many of those we might need extensions for. We have to look at budgets, need, and quite honestly, the data that we were collecting on those services, because as I said, we want to make sure we're making database decisions. So we're very aware that those services are coming up, and we're hoping to request some extension soon.
Okay, thank you. That's all the questions I have.
All right, thank you. Well, thank you so much for the presentation. No one else is on queue. We really appreciate getting these updates, and it's very informative for the public. So seeing no further questions, I'll direct the clerk to receive and file that update. And seeing no further business before us, I'll declare this meeting adjourned.